Coronavirus cases in Wisconsin, as we mentioned earlier in the show, continue to skyrocket.
And it's bad timing as the flu season begins and people stay inside more with the cooler weather. Here to talk about it all is Dr. Jeff Potoff, the Chief Quality Officer at UW Health. He's also going to bust some flu myths in just a minute, but welcome back.
Hi, Dr. Potoff. Good to see you.
Good afternoon, guys.
The Badgers' first football game is Friday night, and people are going to want to tailgate.
Yeah, they're going to want to, and we have a really healthy game day culture here in Wisconsin, but this year it has to look different. If we gather in large groups, if we do anything close to tailgating, it's almost a guarantee to be a super spreader event given how prevalent COVID is in our communities. So let's get creative. Let's figure out how we can heckle the Illini over Zoom or, send some quick texts to our friends. But we need to do it virtually. We got to be with our family units or a bubble. We can't gather with large groups this year.
Well, and the numbers today will reinforce that. Another daily record of new cases in Wisconsin, almost 3,633 deaths today. What is the hospital capacity like right now at UW Health?
We're being stretched. We're having to evaluate, every handful of hours, what our capacity is, how we're going to make things fit. So, it's a tense time right now. We're really at the peak of this pandemic in Wisconsin. It doesn't look like it's getting better, and hospital capacity is very tight.
How concerned are you about all this?
I'm pretty concerned. I don't have a good idea of how things are going to change in the near future. And what I don't want to be in is a situation where we as medical professionals are trying to decide who gets health care. We've been blessed in the United States where we have a lot of resources and people who need help can get it. And this pandemic is putting that to the test. It could come down to deciding who gets medical care that they need and who doesn't.
And now flu season is starting, and we've talked a lot about the fears of a twindemic. And you've talked a lot about everybody should get their flu shot, but there are a lot of misunderstandings and myths about getting your flu shot. What's the biggest one?
Yeah, I think there's a couple, but the biggest, and it gave me the flu. We'll hear that a lot. People think that if they get the flu shot, that there's a risk that the flu shot can actually give them the disease. And we know that that's just not true. The injection that you get from a flu shot, it's inactive. That shot cannot possibly give you influenza.
Another myth is that the flu shot will protect you against the stomach flu.
Yeah, we use the word stomach flu pretty liberally, and it's a bit of a misnomer. So there isn't really a stomach flu. There are viruses that cause gastroenteritis, so, nausea, vomiting, diarrhea. But influenza is not one of them. Influenza causes respiratory symptoms, muscle aches, sore throat, doesn't cause GI symptoms. If you have those symptoms, you have something else.
All right, another myth is that the flu is more dangerous than COVID-19.
Yeah, clearly that's not the case. Even in our very worst influenza seasons, we do not see nearly the amount of death that we are seeing with COVID-19. If you have a choice between COVID-19 and the influenza, I take influenza 7 days a week and twice on Sunday.
Wow.
Wow, that's persuasive. And some people say they don't think they need to get the flu shot every year.
Yeah, that's just not true either. So influenza has a nasty habit of mutating, and it changes just enough where your previous immunity that you got from either having the disease or the flu shot won't completely protect you. Now, it'll provide you some protection, but if you get an influenza vaccine and it matches the strain that's going around, you're very likely to not get influenza at all. Or even if you do, it'll be a very mild case just because your vaccine that you got this year has afforded you some protection against whatever strain ends up coming across your way.
How do you know it's the flu and not COVID or the other way around?
Quite frankly, early on, you can't tell. That's why if you have flu-like symptoms or COVID-like symptoms, you're going to have to get tested to know the difference. This year, to be safe, I would assume until you get a test that you have COVID-19 and take those precautions, especially right now with COVID-19 just so much more prevalent than influenza in our communities.
Well, and back to the game on Friday night, do you think there's a potential there that if people don't observe the rules on campus, it could be a super spreader event? And campus is doing well right now in terms of their case numbers.
Yeah, I think you hit it, Susan. So there's so much COVID in our communities that even what we would probably consider small gatherings, 10, 20, 30 people, there's a really good chance that someone in that group has COVID, can spread it, probably doesn't know they're sick. And we'll see super spreader events here if we have parties tailgating large gatherings this Friday for the Badger game.
Get a flu shot and watch the game on TV by
or
yourself.
Zoom, yeah.
Doctor, good to see you again.
Thank you, Dr. Potoff. Thank you for your time.
See you next week.
See ya.
There's more at 4.